You guys are having a blast over there. Look at me, I'm so bored.
Jacob,
Yeah, it was like so
Jacob.
bad, right? Yeah.
Jacob, are you listening to me?
Just to say, one of my friends just came to call you back, okay? Or I'll text you. Yes.
Jacob, I'm so hungry. Let's go for a dash.
No! I'm totally broke.
See, man, I'm so hungry.
Okay.
You're not interacting in a proper way.
Uh-huh.
What is this? You're using so much of colloquial slangs?
Mm-hmm. B2W, when did my colloquial slang become a problem for you and why do you think it's totally inappropriate?
See, Jacob, you're not supposed to use such slangs.
Why? What's wrong with it?
Jacob, which world are you in?
Of course, I'm in this 3D reality.
Is it?
Yes, it is.
Are you a trainer?
Of course, duh.
But you're not behaving in that way.
B2W, what made you think so? And moreover, I want to ask you one thing. Why do you think that my slangs are inappropriate? Totally inappropriate.
Jacob, you're using so much of colloquial slangs, sounds and words. You're not supposed to do that.
What's wrong with them? You have been listening to me like more than a year or something and now you're saying that it's not at all appropriative?
Yes, of course, I can understand, but still, see certain situation, you're not supposed to use that.
Can you please tell me what are those situations where I'm not supposed to use colloquial slangs? Come on, let me get it from you.
Of course, I can tell you. We are not supposed to use this colloquial slangs, sounds and words when you do a role play, especially in our OET 2.0 speaking subtest.
Yes, definitely. OET 2.0 speaking subtest should be totally professional. No need of any sort of colloquial slangs or any sort of words, for instance, aha, okay, yeah, you know, damn sure. Do you even think that saying such type of colloquial slangs can have a very bad impact on patients or the relatives?
Yes, of course, when we use these colloquial slangs or sounds or words in your role play, definitely that will affect your score. Okay, so and one more thing that I would like to tell you is, if you need to convey any message that will give a negative impact, okay, so when you use these colloquial slangs, the patient or the interlocutor, they may think like you're not interested to answer, like you're not interested to reply for the patient query, or else you are very busy, you don't have enough time, or you don't know anything.
I understood, Ashwini, what exactly you want to convey to me. Usage of colloquial slangs are actually going to reduce the mark when you're appearing for OET 2.2 speaking subtest, isn't it?
Yes, of course.
It seems like as if you were degrading yourself for something while speaking. And apart from that, do you think that there could be many other reasons that actually portray why usage of colloquial slangs could actually bring you a low grade? Could you tell me a couple of points?
Yes, of course, Jacob. You know, when we use these colloquial slangs or sounds, or that might be a word, okay? So what the patient or the interlocutor, they may think, like sometimes we don't know anything.
Exactly.
We're not interested to reply for their queries.
Exactly.
We don't want to attend them.
Wonderful.
We don't have enough time and we are very busy.
Alright.
Okay, so these are the things that will go through the mind, right?
Definitely.
So,
even I have this particular queries in my mind. You know, sometimes when I'm in hospital and all, and when somebody is using a colloquial slang when I'm inquiring something, I too have thought that they're so busy to answer me.
Yes, definitely.
I also have a couple of points in my mind. Can I just simply spell it out?
Yes, of course, Jacob.
For instance, the relative or the patient might think like the nurse is so confused. The nurse is having no idea of the patient's condition or what the patient treatment is going on.
Exactly.
Or sometimes the nurse is trying to ignore the patient or the relative. Sometimes the nurse is feeling so burdened. And sometimes the nurse is feeling so irritated, like constantly the relative or the patient is asking them questions regarding their treatment options or regarding what exactly is going through. I mean, in the hospital, like it's a total chaos. the relative or the patient, they don't understand, isn't it?
Yes, of course. So now I think like our students are totally they understood regarding these colloquial sounds. And could you please list just a few of these sounds so that they will understand more?
Definitely.
Yes.
Why not? So, dear viewers, I want to tell you there are so many colloquial slangs, there are so many colloquial words. For instance, okay, yup, yeah, damn sure, you know, well, yeah, all these words or all these slangs are going to have an ill impact on your OET 2.2 speaking test.
Yes.
So, viewers, I want to humbly request you, whenever you're engaging in an OET 2.2 speaking test, please do not bring such slangs. It might be a flow, it might be a slip of the tongue, but when there is a necessity for you to say yes or no, say yes or no. Don't just simply wind up by saying yeah, nah, nada. It's not at all appropriate. I hope this particular video is going to have a great insight regarding colloquial slangs and their usage. Why? Because many times I have seen that many candidates, they use these colloquial slangs like a panache. You know, it's like a fashion for them. It seems like, you know, having a chewing gum in their mouth and like, yeah, you know, it's like, hold on a sec. It's like totally funny. I have almost, every time I have find it funny. Seriously, I'm telling you, I find it really ridiculous.
But you know, Jacob, like that is becoming habitual for them.
Exactly.
Because once if they use that particular word or slang, okay, they stick on to that. They'll continue with that. Okay. So this is a humble request from our side. Try to avoid all these sounds when you speak and speak naturally.
Yes. Alright guys, thank you so much for listening to this particular video. Once again, Jacob John
And this is Ashwini Vijay
from Teachers Academy.